Thank you, Ellen. The following segment is sponsored by Dr. Wander. We're helping everyone become a great you this week. Dr. Stephen Wander is the owner and director of admissions of Integrated Health Center of Maryland. He's an international best-selling author, and his latest book is Reverse Your Diabetes, Change Your Life, where they help patients reverse their diabetes. They are having a free diabetic dinner event on March 17th. So we've got Dr. Wander here along with Amanda Wander, patient care coordinator, and one of their patients, Patrick Farrell. Thank you all so much for being here. How did you get on this path?
You know, when I was about 12 years old, my grandmother, she took us out to lunch and she put out 12 pills. And I was like, wow, what are all those pills for? And she said, well, the first one's for my sugar, the second one's for my pressure, the third one's for my cholesterol, fourth one's for my thyroid, the fifth one's for the side effects of the first one, the sixth one's for the side effects of the second one, and on and on. And I saw her go downhill in her health trajectory very quick, oral medication after oral medication, amputation of her foot, until about 3 months after that lunch, she was gone.
Wow.
Yeah.
So, I mean, of course, that's going to leave quite the impact on you. So you, what is different the way that you work with your patients?
Well, typically a patient is told they're diabetic, and then they go, basically they start with Metformin, and then they go to Glipizide, Glipizide, Actos, Januvia, Farxiga, Invokana, Jardiance, until eventually the doctor waves his finger at the patient and tells them, you're going to have to be on insulin. And so what we do is specifically test each patient from the ground up, and based on their individual results, build them a program that's specific to them.
Okay, so you're not masking symptoms, you're not just throwing pills at them, it's specific what's going to help them hopefully reverse the diabetes.
That's right. Yep.
And Amanda, when you're looking for a patient, what is the key factors that you look for?
Well, so my job is patient care coordinator. So what I do is once Dr. Wander accepts a patient into care, I follow them throughout their program for anything that's non-clinical, whether that's testing or food or questions or support and motivation. So one of the main things we're doing when we're looking for our ideal patient is their motivation and how they're going to achieve their goals. And I actually brought one of my patients who has successfully reversed his type 2 diabetes, Pat.
Hi, Pat. So you are their success story.
Correct.
What was your journey like?
So I first interviewed with Dr. Wander, and I shared with him that my blood sugar was very high. It was over 300. I was my A1C was at about 12. I had high blood pressure at the time as well, and they had me on insulin, 10 units of insulin, metformin, as well as high blood pressure medicine, and they were all making me feel horrible. And I wanted a change in life, you know, and I didn't want to deal with something that could cause death. I interviewed with him and took on his program, and I'm happy to say after completing his program, I'm currently on no medications, I've lost 40 pounds, and I am diabetic free.
That's amazing, and you feel awesome, right?
I feel fantastic, absolutely.
So he's just one of many success stories that you guys have had. I see some interesting items that you have here on the table, Doc.
So, you know, what patients would want to achieve is first they want to eliminate the need for the devastating complications like my grandmother, amputation. A lot of patients obviously want to lose weight, and then one of the things they also want to do is they want to get rid of their medications, which
medications?
Yes, those medications. All those
It's a good thing he's a good partner for you.
Exactly.
But that, I mean, is what we see, right? I mean, people are just inundated with pills, and as Patrick said, they're not feeling any better.
Right, correct. So what we're able to do is by building the program from the ground up specifically for them, then with the help of their prescribing doctor, they can start the process of reducing and eliminate their medications, which every patient says that's one of their goals.
Of course, of course. And Patrick, I mean, you come highly recommend them, right?
Thank
I mean,
you.
you
Yeah,
are
absolutely.
an incredible story. And what is your life like now?
My life's great. I mean, I'm active. I had a lot of loss of energy at the time when I was first diagnosed. I have a lot of activity going on in my life that I like to do. I play softball a lot, you know, 2 days a week, which I'm currently actively still doing. It's great. I feel fantastic. And the best thing is I'm free of medications.
And he lost 40 of these. This is a pound of fat.
That's a pound, okay.
He lost 40 of these.
That is amazing. How do people find you guys? And you know, if they wonder if this is something that you can help them with.
Well, website reversemytype2diabetes.com, or they can call 301-770-5395.
And the diabetic dinner event that you have coming up, what can people expect from that?
We go into a little bit more depth on what type of testing we need to do and how each program is going to be different for each person. So we go into the different aspects of what that could be. We explain to them the effects of having this disease long term and what might happen, and so prevent, obviously, amputation, heart attack, stroke, like unfortunately my grandmother went through.
Well, your grandmother sounds like an amazing woman that obviously spurred something in you, and I love now that you're giving back. And what people want is that individualized approach, right? They just don't want to get that whole thing of pills that they have to take. And Amanda, it's so wonderful that you're there, knowing they know that you're there every step of the way.
Yeah, it's really great. They come in and
to get taken care of. Well, thank you guys. Patrick, thanks for sharing your story with us. If you want more information about the March 17th Diabetes Reversal Dinner, visit reversemytype2diabetes.com or call 301-770-5395.